All right, Chief. There, we got you back there. All right, well, I want to thank everyone for being here this afternoon. I just, as you saw, just got off a aerial tour with Sector San Diego, where we observed progress on the administration's efforts to build a very enhanced border wall system. So really, with the direction of President Trump, we have been able to make great progress on that border wall system. We have over 180 miles built of new border wall system. We are on track to build 450 by the end of this calendar year, and we'll have milestones of the 200-mile mark, 300-mile mark, and 400-mile mark throughout this calendar year. So we saw that. We saw secondary fencing being built, primary fencing being built over some very rugged terrain here in San Diego sector. And we'll continue to prioritize building that border wall system. It provides our agents on the ground, our men and women at Border Patrol, that impedance and denial that's absolutely needed for them to do their job day in and day out. And it's really designed so to funnel traffic, to funnel that illegal crossing to ports of entry where we have the infrastructure, we have the border agents, we have the technology to look for that contraband and to really deal with them at that area. Earlier today, I also had the chance to spend some time with our OFO leadership at the San Ysidro port of entry, where we talked about a number of issues to include the travel, the restrictions on travel, on non-essential travel that we've put in place, that they are certainly working towards. Also met with a number of leadership from the department, including CBP, ICE, obviously the Coast Guard, but from a variety of components here at Sector San Diego, where we talked about a number of issues regarding COVID and some of the challenges the department is facing. And really, why I've spent time here today in San Diego and yesterday in both Nogales and Tucson is really to hear about the challenges of our frontline officers in a COVID environment. Men and women of Border Patrol, the men and women of ICE, OFO, Coast Guard, TSA, these are our frontline operators that are keeping the Homeland safe. They don't have the opportunity to telework. They don't have the opportunity to social distance like we're doing here today. They are on the front lines, and their mission and their job puts them in harm's way, and so we want to make sure that we hear from them. I wanted to make sure I heard from them personally to see if they had any issues, what were their concerns, and so I thought that that was critically important. Also had the pleasure today to talk with Mayor Faulkner, Sheriff Gore, U.S. Attorney Robert Brewer, where we again talked about a number of challenges that we're facing because of the COVID environment, to include again that cross-border traffic, the shifting tactics of our adversaries of the DTOs and the like, moving contraband and illegal goods across the border. So again, thank them for their partnership. It was a good conversation. I'd like to start off by saying a couple of other key points I think is critically important in the administration's push to again secure the border, and we're doing that on a number of different fronts. And I will again reiterate, it's really at the president's leadership that has put a focus on border security. And I've said it before, border security is homeland security, is national security. So I've talked a little bit about the border wall system. Critically important. We put restrictions in place early on during the pandemic, both with our northern border with our Canadian partners, as well as here on the southwest border with our Mexican partners, to restrict non-essential travel coming across that border in a pandemic environment. Safe to say that that has worked. We've seen traffic, depending on which port of entry that you're looking at, you've seen traffic being reduced anywhere from 60 to 75%, while keeping the legitimate cargo and trade moving, and that has stayed pretty constant, has even increased at certain ports of entry. So we're very proud about that, and we'll continue to look at that. Those restrictions do expire here, I believe, on the 21st of May. We will likely look at expanding those restrictions as the country continues to be phased opening approach, state by state, governor by governor. So we're taking a look at that as well. Also want to talk about the actions that we're taking on illegal entries into the U.S. In a pandemic environment, it is not realistic, nor is it safe or secure to keep migrants in Border Patrol facilities for long periods of time. So the CDC was very clear with us, with DHS and with CBP, as we needed to make sure we did not house those individuals in our facilities, both for our workforce protection, protection of our DHS officers, protection of the American people, and protection of other migrants. So we've been very successful at doing that over the past roughly 2 months. We return those that we apprehend illegally, about 80% of them. We return them either to Mexico, the Northern Triangle, within about 2 hours. About 120 minutes after they cross the border, they are returned. And that's a very stark difference to what it has been in the past, where it's been several weeks, months, and even longer. So we're very proud about that as well. And the big factor there is our in-custody numbers. The in-custody numbers are those folks that we have in Border Patrol stations. So if you back up to a year ago this time, you would have seen thousands of folks in our Border Patrol stations. So you can only imagine what that would be like in a COVID environment. Today we have under 100 folks in custody all across the southwest border in custody, and it's really quite remarkable. A year ago, thousands and thousands and thousands of folks in our custody. So we're very proud about that. The men and women of Border Patrol, CBP, OFO have done a great job in managing that, and will continue to do that as we move forward. Also want to take a minute just to talk about reopening the economy, reopening the country as we continue to move forward. The White House Coronavirus Task Force, I've been a part of that task force, have done some exceptional work laying out guidelines, the President's guidelines to opening the economy, the testing blueprint to do that. We've provided a lot of guidance to both states, to governors, making sure that they take a look at state by state, county by county, area by area on how they get the economy back up and running. It's critically important that we do that. We do that in a safe way, in an efficient way, but we've got to get the economy back up and running. President Trump's economy before the pandemic hit was next to none, and we need to get it back that way. And I think a lot of folks throughout the country feel the same way. They want to get back to work. They want to get back to their normal daily activity. That's going to look a little different. We'll continue to do some of the social distancing that you see here and some of the mitigation measures that will continue throughout the summer, throughout the fall. But we can do that in a smart way where we open up the economy. So let me stop there, but that's really the reason for the trip out west over the last 2 days. Again, it's to support the men and women on the front lines of the Homeland Security mission, both CBP, which includes Border Patrol and OFO, ICE, TSA, Coast Guard, making sure that we hear from them directly on what they need to operate in this pandemic and COVID environment. And just one last point before I take questions. The protection of the DHS workforce is first and foremost on my mind, on other senior leaders at the department. Any meeting that we start with, that we talk about the pandemic measures that we're taking, always starts with the workforce. How do we continue to protect them? How do we continue to let them do the job that they've done, that they can come to work, they can go home, see their family, come back to work, and know that they're safe, and but continue to do their mission. So we continue to supply them with PPE, supply them with the best guidance, continue to coordinate with CDC, making sure we have the best medical advice available. As the virus changes, as the medical advice changes from CDC, we'll change our tactics within DHS as well. So we've done that since day one, and we'll continue to do that. So let me stop there, and I'll take a few questions. Sorry, can you speak up?
What kind of discussions are being had about the outbreaks being caused in Central America by deportations? Is there a reason why some of these migrants or all of these migrants are not all being tested prior to these deportations?
Sure. So the question was about repatriations of migrants from DHS facilities, ICE facilities back to the Northern Triangle, back to South America, and really all across the world that we do. So we're taking a look at that. So we have a number of procedures in place at our ICE detention facilities on how we look at individuals that are perhaps symptomatic or at least meet certain CDC guidelines. So we isolate them, we cohort them, and in some cases we test those individuals before they go back to their home country. So there's a number of things that we do that we put in place. All of the countries that they're repatriated to, we're in close contact with them, again, through the State Department. Almost all of them have quarantine procedures. They are testing on their side as well, so it's a very safe environment to do that repatriation. So ICE does that on a daily basis, on a weekly basis. We feel confident in the measures that we can do. We can always improve, and we'll continue to improve that process every day as that goes forward. But these countries, just like the U.S. has an obligation to take U.S. citizens, these countries have an obligation to take their nationals back, and that's part of this process.
Secretary,
Yep.
a few weeks ago, it was said that a new safety protocol was going to be implemented at the border, where people crossing, especially from Mexico to the United States, they were going to take the temperatures. Is this something that is being done as of right now? It's going to be implemented in the near future because of the COVID-19.
Yeah, I don't know who said that. I'm not sure. CBP. So we're always taking a look at what our ports of entries look like. And as that traffic comes back, and again, right now that traffic that's just coming across is just essential trade and travel. We feel confident. I was just, again, at the San Ysidro port of entry today. They're doing that social distancing. They're doing that mitigation. When we talk about temperature checks, we're looking at that. We need to make sure that we balance both the safety and the security with that legitimate flow. So you could start taking temperatures of everyone at a port of entry, all the pedestrians. You're going to back up lines. You're going to perhaps create more issues than you're trying to resolve. So it needs to be a balanced approach. I talked a little bit about that with the mayor and with others that I met with today. We're taking a look at that. It's not currently in place today, but it's something that we're always going to take a look at. And again, that direction would come from the CDC. That would come from the medical professionals that we talk with, not only at the CDC, but on the White House Coronavirus Task Force. If they think that is the right procedure, DHS will operationalize that. We'll do that in an efficient way at ports of entry if we need to.
The situation at the border, specifically with almost 250,000 American people living in Baja California, but the lines are only centralized, most of them have only one or two, extending about 2, sometimes 3 hours before crossing for Americans. It has something to do with the coronavirus specifically, or is something else?
So you're exactly right. So a lot of the travel that we see across the border, particularly here in San Diego and Tijuana, is our U.S. citizens, our LPRs coming back and forth across that border. As far as wait times, I would say OFO, CBP monitors those wait times pretty closely. We've had to adjust our staffing as those numbers dropped. We've had to adjust that to the commercial side as those numbers increase, and we keep that up. We also have to look at those employees that are in the pipe. So our training academy has had to shut down during COVID-19. So new recruits, new individuals that would come in that would supplement, that has been disrupted as well. So we're adjusting. We're making those adjustments in real time. But again, I talked with San Ysidro, I talked with Nogales Port of Entry yesterday. They're making those adjustments as that traffic comes back. The wait times are very similar to what they were prior to COVID. Again, depending on when you take the wait time, whether you take it on Cinco de Mayo, maybe you take it after Mother's Day, they're going to be a little bit higher. Everyone knows that. But overall, the wait times are fairly constant.
I was going to ask you about immigration detention. The Oakland Mesa Detention Center here in San Diego has twice as many people testing positive as any other detention center, and the number of ICE employees is also relatively very elevated. I wanted to know if you're aware of that, if you know why that is, and on a broader note, what your assessment is of the conditions in ICE detention in terms of the spread of the virus. Do you feel you're doing enough? Do you plan to do more?
Sure. So I did talk to ICE leadership here in San Diego today, and we talked about Otay Mesa. I will say overall, I'll address that issue a little bit more globally across all ICE detention facilities. So ICE has put in, again, a number of measures working with the CDC in almost all of their, I would say in all of their facilities. Most of their facilities are down to about 70 to 75% capacity. They're trying to do that social distancing as much as they can in a jail-like setting, which is what our detention centers are. So they'll continue to do that. They continue to do the sanitation of those facilities. ICE and DHS, we proactively have released about 900 individuals from ICE custody, those that are in those vulnerable populations, so that would be elderly or those with underlying medical conditions. We're continuing to do that. We're continuing to look at those populations. We have a number of facilities. You mentioned one, but there's one or two others across the country as well that have some higher number of outbreaks. We've stopped intake into those detention facilities. And we're addressing those as best we can. We're also, again, go back to my earlier comment about protecting the workforce, ICE employees, making sure that they have the PPE that they need to do their job every day as well.
Are those 900 nationally or those from
Nationally. Nationally. Back here.
Can you provide us any detail on what mechanisms are in place to enforce the limited travel, essential only? Talking about people who cross the border, nobody's being asked, folks coming back and forth.
Yep.
It looks like shopping trips time to time. What mechanisms are in place to enforce that?
So we specifically put that directly in the hands of the ports of entry. So the port director at San Ysidro, at Nogales, at El Paso, all across the border, they have the ability and the direction to adjust that. They know their port of entry best. They know the type of traffic that's coming across that. They know when the rush is, whether it's in the morning, the afternoon, or the evening. They know what type of traffic is coming back. We publish in the Federal Register a very specific set of what is essential and what is non-essential. We're continuing to look at that to see if people are abusing that. But I will say it's, again, we have seen a significant drop in the non-essential travel, but we'll continue to take a look at that. Do we need to tighten down on it more or not? That is something to look at. But as regarding U.S. citizens and LPRs, again, the vast majority of folks that we see coming across the border here in San Diego and San Ysidro, those are individuals that have a right to come back and forth across that border into the U.S. But again, we're taking a look at it, making sure that folks are not abusing that and seeing what changes we need to make. Sure. Right over here. Right. Yep. Sure. So I'm not going to get ahead. I don't have anything specific to talk about, but the non-essential travel restrictions we see are working. Again, in our discussions, with my Mexican counterparts and Canadian counterparts, both have been over the last, let's say, about 50 days that we've had those in place. Both have expressed a willingness to continue those, at least in the short term, and we've got to look at that. It's one thing to look at how the U.S. is recovering and where our curve is, but a lot of this is where Mexico's curve is and to the south of Mexico as well. So we've got to look at a number of factors to see how we ease those restrictions when it's appropriate to do so. I'm not sure that it's appropriate to do so in the short term. We've got to look a little further out. Regarding the second part, we've heard that as well. I think it's unique here to Tijuana and San Diego. Individuals coming back over for medical procedures that you talked about. Again, mostly U.S. citizens and LPRs. So a lot of the discussion I had today, again, with some of the local leaders I talked about, was just about that issue and seeing if we need to do something specific here. Again, nothing to announce, but it was interesting to get their perspective on it. And we're going to talk. We had Dr. Eastman from our Chief Medical Office down here in the past week or so, taking a look at not only conditions here on the U.S. side, but conditions on the Mexican side as well. So we're going to follow back up with the doctor and see what type of recommendations he has as well.
Yes, sir.
Right back here.
Secretary, given the cybersecurity issues with our elections nationwide, and looking at the November elections, and also the possibility of stay-at-home orders in many places, would you advocate on the task force for a national mail-in vote or for money to help state election systems execute a national mail-in vote?
Sure. So obviously, as you know, elections are run locally by states, by individual secretaries of state in almost all instances. So that's going to be their decision at the end of the day. Our Cybersecurity and Infrastructure Security Agency put out I believe, an advisory last week that talked about some inherent risk of doing that. So I think from our perspective, making sure that voting systems are not vulnerable is really what the department is doing. So we do see some risk. We do see vulnerabilities in that mail-in balloting, electronic voting, and a variety of different aspects. So I'd refer you to that advisory where CISA outlines the risks, the vulnerabilities, and some actions that states and local election officials could take if they think they need to go down that road.
What can the federal government do to help states execute national mailings, state-by-state mailings?
Well, again, from a national perspective, CISA is involved. Again, Cybersecurity and Infrastructure Security Agency has relationships with every Secretary of State, offers a number of cyber security offerings to those individual states from an election security standpoint. So we're here, we're at the ready. If they have questions, we're happy to provide that. Again, we sent out an advisory that details the risks, the vulnerabilities with that type of voting. Oh, let me go back here.
Talk about the methamphetamine and fentanyl seizures. We've seen an increase along the southwest border, even here in San Diego, and whether there's any evidence cartels are trying to take advantage of the situation.
I think the best way to answer that would be the cartels are always looking to take advantage of any type of situation that we have. So as we put up effective border wall system, we're going to see their tactics and their procedures change. And so we're seeing more of it at ports of entry. We're seeing more of it in the commercial lanes, as well as both the passenger and the pedestrian lanes. So we'll continue to take a look at that, but that's exactly how that's designed to work. We want to funnel folks to the ports of entry. It's where we have the officers, it's where we have the infrastructure, we have canines, and we have the technology to do that job. We don't want to do that in the middle of the desert. We don't want to do that in very remote areas of the border. We want to funnel them to ports of entry, and it's working.
Okay, one more question.
One more. Yep.
So last week we reported about the first death of a migrant detained under ICE custody at the Otay Mesa Detention Center. Can you explain what are the protocols for these migrants to get help and to the medical help they need and be transferred to a hospital before it's too late?
Sure. I talked a little bit about that earlier. ICE has medical in all of their facilities, where it's the ICE medical staff or it's contract staff. So we're, again, very robust conditions within those detention facilities. We're liaisoning and coordinating with the local public health officials. If it gets to a point where they need to go to a hospital, they need to get that testing, they need more medical care than what's available in that detention facility. And we do that every day with ICE. So we'll continue to do that. We'll continue to look at those conditions. We do, again, as I mentioned earlier, we do those voluntary releases for those vulnerable populations. But what we're not going to do is we're not going to release all of the detainees in our care. It's irresponsible. It's irresponsible to the communities that we release them into. And so we're going to do this on a much more targeted effort, case-by-case basis, looking at individual cases, referring them to the public health officials, making sure they get the medical care that they deserve. But we're going to do that in a smart way. All right, thanks.
Thank you very much, everyone.
Birthday is tomorrow, and
Thanks.
we have no record of your birthday. Can you give us a date of birth?
This is not my phone.
Secretary,